Hello class, this is Oscar for HIM 5340, and the topic of my presentation is using health information exchanges for public health surveillance. Functions of health information exchanges include sharing patient information, allowing access to patient information without requesting it, and facilitating patient care. The Office of the National Coordinator of Health Information Technology, or ONC, provides resources through healthit.gov. And one of the benefits that the ONC identifies for health information exchanges are its benefits for public health monitoring. In this presentation, we'll look at barriers to using HIE for public health surveillance and the impact of disease surveillance and the future directions of HIEs. Now we'll discuss the barriers to HIE public health surveillance. A study conducted at a county health department in Texas that used surveys and interviews to learn about barriers to HIE public health surveillance found that insufficient staffing, variation in the interpretation of laws, and lack of coordinating health IT strategy for public health were obstacles that the health department was experiencing. Solutions proposed in the study were to develop skills and staff and develop approaches that use HIE for public health until legislation becomes clear, and develop health department IT architecture that can transition to an electronic public health model. The findings identified by the study can be turned into actionable ideas for entities such as local, state health departments, lawmakers, and regulatory agencies. Now we'll look at HIEs for STI reporting. A study conducted in a New York County Health Department interviewed the employees to find how HIEs impacted its STI reporting. It found that the department was able to treat more cases of chlamydia with 77.5% of reported cases treated in 2011 and 88.4% of reported cases treated in 2012. The number of treated gonorrhea cases also increased from 79% in 2011 to 93.1% in 2012. The findings in the study support the idea that HIEs are beneficial for public health surveillance, and other local health departments can use the outcomes of the study to support their decisions to invest in HIE systems. Next, we'll look at HIEs for chronic disease tracking. A study conducted on a HIE system that uses natural processing language to process the data it receives looked at its reliability by comparing it to the database where the data originates. The authors found a discrepancy of 3% between the databases for diabetes and hypertension. The authors concluded that the information the HIE provides is useful, but limited. Other takeaways from the study are that it was able to show the capabilities of HIEs that HIEs have for natural processing language, and the methods used by the authors can be used by other healthcare systems to assess the reliability of information that is transmitted. Finally, we'll look at the status of HIEs and their future. In recent years, the expectations for HIEs have been set low, and the meaningful use measures from 2015 to 2017 required that summaries are electronically transmitted for more than 10% of transitions of care and referrals. HIE measures can be improved upon in the future. One way would be to increase the percentage of summaries that must be transmitted, to have providers make more use of the HIE systems they already have. Another way would be to implement measures that focus on other aspects of care such as lab results or post-operative visits. Additionally, the measures can be developed so that they appear more scalable by having smaller milestones for HIE measures and progressively increasing them. Having the measures seem more achievable can encourage more providers to participate. These are my references, and this is the end of the presentation. Thank you for listening, and leave any comments in the forum.